Hi everyone, welcome to this overview of physical activity. The aim of this video is to get you thinking about your role in helping people to establish physical activity habits. The structure of this video is based on a chapter on the topic written by Paul O'Halloran. Now, Paul O'Halloran is a psychologist and researcher at La Trobe, and he has contributed to many important papers on physical activity and health. So without further ado, let's start with the first slide. So this video follows the format of O'Halloran's chapter in the text Applied Topics in Health Psychology. If you are able to get access to a copy of the book, it has some interesting and still relevant work on health psychology. Lester Jones, the module leader, also co-authored a chapter on interdisciplinary working in pain in the same volume. Now in this video, we will first look at the benefits and possible risks of physical activity, after which we will explore together what is considered a sufficient level of physical activity. Although we know that physical inactivity is common, it is good to look at some statistics on how much physical inactivity and sedentary behavior is prevalent in the population and what are the risks involved with sedentary behavior. To conclude, we'll also discuss what are the approaches we can use as health professionals to facilitate an increase in physical activity levels in your service users, patients, and the general public. So let's firstly explore the physiological benefits of exercise. In terms of weight management, regular moderate exercise will prevent weight gain greater than 3% in most adults as they age. As an intervention, a recent systematic review and meta-analysis found that for every 30 minutes per week of aerobic exercise, this was associated with a reduced body weight of about 0.52 kilograms. And typically, exercise is the best predictor of being able to maintain weight loss following an intervention involving physical activity and dietary changes. While the magnitude of weight reduction mentioned may be considered modest, the effect is considered to be clinically significant. Evidence also suggests that those who are physically active are less likely to suffer from disability or premature death. Leisure time physical activity is associated with reduced risk of coronary heart disease. Leisure time physical activity refers to any physical activity undertaken during free time, outside of work, housework, or transportation, and is chosen for enjoyment or recreation. This is obviously in contrast to what is termed as occupational physical activity. Physical activity also seems to be protective against cancer by increasing circulation, improving immune function, enhanced DNA repair, and for bowel cancer specifically, reduction in bowel transit time. Physical activity, particularly aerobic and resistant type exercise, is protective against type 2 diabetes by providing glucose tolerance. Physical activity also can protect against osteoporosis and reduce risk of upper respiratory tract infections. In terms of the mental health benefits of physical activity, a medium effect size has been reported in response to physical activity on mood, and this is by a paper by Zhang et al. 2025. Both long-term activity habits and single sessions of exercise are associated with improved positive affective states such as feeling re-energized, revitalized, and a sense of well-being. What is also important to note is that physical activity not only lifts mood, but has been shown to be protective of depression and may also reduce depression itself. There is loads to explore with regards to the benefits of exercise and when it comes to musculoskeletal health. Now, Lester has curated the above 4 articles you can see with the QR code on the screen that speaks to several important topics on the benefits of exercise. You may now press pause, scan the QR code to browse and download these articles. When you're ready to continue, simply press play. A review paper by McGee and Hargreaves 2020 explored our bodily adaptive responses to exercise. And this is mainly through molecular mechanisms in different physiological systems in our body. Now, this particularly valuable paper provides us with a context that goes beyond the musculoskeletal system that physiotherapists tend to look at, and arguably reinforces the need to take a multi-systems approach to musculoskeletal health. As with all things in life, there are potential upsides and downsides to physical activity. The usual risks associated with high-impact physical activities or sports is the increased risks of injury. An evaluation of active and inactive groups did not find a difference in injury prevalence. Another potential risk is when people with pre-existing conditions engage in exercise. Now, this risk is increased when the pre-existing conditions have been undiagnosed, for example, certain heart conditions, and these can often be fatal. From a psychological point of view, negative effects have been associated with overtraining, and this includes anxiety, insomnia, and fatigue. But despite these potential risks, it is possible to manage and mitigate them alongside, so long as a health professional is involved in the management of these individuals. Now, given the known benefits of physical activity, an often asked question is, how much physical activity is enough? Does this vary based on the age group? There are published guidelines on physical activity that often relate to the minimum physical activity required to obtain a benefit. Singapore has its own physical activity guidelines, which is derived from the World Health Organization guidelines on physical activity and sedentary behavior. Many other countries also follow the same recommendations. The recommendations for people who are aged between 18 to 64-year-old for general health benefits is about it is recommended that a moderate intensity of physical activity is to be performed by the individual for at least 150 minutes per week. In this case, moderate level of physical activity includes planned exercise such as brisk walking, swimming, double tennis, or badminton, to give you some examples. But also, this can also include incidental physical activity, for example, walking to shops, or for those who do have a garden, gardening as well. Now, adults are also recommended to incorporate 2 days of strength training in addition to the aerobic exercise. Something to note is that physical activity recommendations for children are generally higher than adults. And the expected outcomes from these recommendations for both adults and children include improved health markers relating to blood pressure, lipid profile, and insulin sensitivity. It hasn't been very easy to find a summary table that includes the recommended physical activity for specific health benefits. So there is, although, a table in the original chapter by the O'Halloran text. However, it is now slightly, it needs to be updated slightly since it has been 10 years since the publication of that text. So perhaps what you can do, an activity that all of you can do for this module, is to see if you can find literature to support a recommendation for these particular four specific health benefits. So weight loss, reduced risk of cardiovascular disease, reduced risk of depression, long-term mood benefits, and reduced risk of cancer. You can report and share your findings in the discussion board on the learning management system for this particular module, which the module tutors will actually set up and queue you to provide your findings and what you search for onto the discussion board itself. So, do we have a problem with physical activity levels? And by mean we, it's the general population. According to a 2022 World Health Organization report, globally, about 80% of adolescents and 27% of adults are not meeting the recommended physical activity levels. Now, the statistics for physical inactivity in adolescents is worryingly high, and the percentage for adults is also surprisingly low. Now, this is for the global population. Does this global statistics apply to Singapore as well? According to the Active Healthy Kids Global Alliance Singapore report card, about 76% of Singaporean school-going adolescents aged between 13 to 17 years did not meet the recommended physical activity levels. And for the Singaporean adults, about 21.5% of adults do not meet the recommendations. So it seems, although Singapore is slightly better than the global average, we still have a problem. And if we can adequately address it, it may actually reduce at least some of the burden attributed to musculoskeletal conditions. Now, we often hear about the benefits of exercise or physical activity, but it's also equally important to understand the dangers of its opposite, the opposite sort of concept, which is sedentary behavior. Now, sedentary behavior is defined as any waking activity characterized by an energy expenditure of 1.5 metabolic equivalents or less, performed while in sitting or in a reclining position. So what does it mean in terms of what specific activity is considered sedentary behavior? So this includes activities like sitting at the desk, like what I'm doing now, watching television, or driving a car. It's important to distinguish this from physical inactivity, which is defined as the amount of physical activity that is performed by an individual. So what it means is that you can be sedentary and still meet your recommended physical activity levels, but that doesn't really eliminate the risks associated with the sedentary behavior. In addition to the usual cardiovascular risk, sedentary behavior is also associated with increased likelihood of dementia, decreased levels of cognitive function, and also higher risks of depression and depressive symptoms. Now, these risks may add up to lower the overall health-related quality of life for individuals, and therefore it is really important to address sedentary behavior on top of encouraging people to engage in physical activity. So, how can we increase physical activity? Do we know what are some of the interventions that work? And what kinds of interventions are considered effective for increasing physical activity? At this moment in time, the rest of the video will touch on are some of the facilitators and barriers which is associated with people engaging with physical activity. And hopefully from these facilitators and barriers, we're able to understand the social, psychological, and physical constraints or limitations that's preventing people or encouraging people to do physical activity. And hopefully that will help us to plan out and individualize plans for long-term engagement of physical activity in the individuals that we see. The promotion of healthy behaviors such as physical activity, healthy diet, not smoking, and limiting alcohol intake is possible in the physiotherapy setting. Now, physiotherapists are considered well placed to provide physical activity guidance and support to a variety of clinical populations and are encouraged to promote physical activity at every opportunity. And in order to encourage lifetime physical activity habits, as I've mentioned previously, it is important to understand the facilitator and barriers to physical activity. We're now going to look at some facilitators for establishing physical activity habits. These facilitators can be used by health professionals to design, promote, and encourage engagement in physical activity and to increase adherence. Personal factors play a crucial role in establishing and maintaining physical activity habits. Perhaps the most significant personal facilitator is enjoyment of the activity. Selecting activities that are inherently pleasurable significantly increases the likelihood of long-term adherence. Knowledge, awareness, and positive attitudes towards physical activity also serve as powerful facilitators. Understanding the specific health benefits of regular exercise can strengthen motivation, particularly when individuals begin to experience these benefits firsthand, such as increased energy levels, improved mood, and better sleep quality. Self-motivation represents another critical personal facilitator, particularly the drive to maintain physical and mental health as one starts to age. Research indicates that individuals who perceive a clear connection between their own exercise habits and their health goals demonstrate stronger adherence to physical activity routines. Social support emerges as a powerful facilitator across multiple studies. Encouragement from peers, family members, and healthcare professionals significantly enhances physical activity participation and adherence. Social interaction during exercise activities also serves as a powerful motivator, making group-based programs like a lot of the group activities that physiotherapists and other healthcare professionals run make these sort of programs effective for many individuals. Consistent scheduling emerges as a powerful facilitator. Creating a personal workout window, a consistent time of day that is dedicated to physical activity, significantly enhances adherence. A study published by the Obesity Society found that 68% of individuals who successfully maintained physical activity had a consistent workout window, and these individuals exercised in terms of the amount of exercise they've actually is more overall compared to those who do not have a consistent schedule. Personalized activity plans that align with individual preferences, capabilities, and goals also facilitate long-term adherence. Tailoring activities to fit one's lifestyle, interests, and physical conditions makes exercise more accessible and sustainable across different life stages. Now, in addition to the facilitators, there are also some common barriers to establishing physical activity habits. You have perhaps experienced some of these barriers yourself. It is therefore very important to identify these barriers and to support people in overcoming them for greater success in establishing physical activity habits. Physical limitations due to health conditions or aging represent one of the most frequently cited barriers to physical activity, particularly among older adults. Specific ailments, injuries, or chronic conditions can significantly restrict exercise options or to create discomfort during physical activity. Fear of injury or pain also serves as a significant barrier, especially for individuals with pre-existing conditions or those who have been physically inactive for extended periods. Safety concerns, both from individuals themselves and sometimes from healthcare providers, can prevent participation even when activities could be safely modified. Lack of professional guidance constitutes a substantial barrier, as many individuals feel uncertain about what type or which exercises are appropriate for their own condition and how to perform them correctly. Now, this uncertainty can prevent initiation of physical activity or lead to premature discontinuation. Inadequate information about available and appropriate physical activity options and programs represents another key barrier. Many individuals simply aren't aware of programs designed for their specific needs or just don't know how to access them. So some guidance from perhaps from healthcare professionals will be useful in this respect. Psychological factors such as low self-efficacy, negative expectations about exercise outcomes, or unfavorable emotional responses to physical activity can significantly impede participation. Past negative experiences with exercise can create lasting psychological barriers that discourage future attempts. Environmental constraints frequently prevent regular physical activity. So the lack of accessible facilities, inconvenient locations, prohibitive costs, and inadequate equipment limit options for people, particularly for individuals with mobility challenges or financial constraints. Now, lastly, the time constraints and competing priorities represent a universal barrier across the age groups. Work obligations, family responsibilities, and other commitments often take precedence over physical activity, especially when exercise hasn't yet been established as a priority habit. As part of the current conversation surrounding management of long-term conditions, you may have noticed that there is a move towards self-management, patient education, and the health professional taking on the role as a coach or facilitator. This is a move that is going away from the more traditional focus of healthcare professionals providing a fix for the patient. What does this move towards a more person-centered approach and educational approach mean for our own practice? Which healthcare context will this person-centered and educational approach be most beneficial? So, thinking about your own practice, can you identify any healthcare context where this approach may not be particularly relevant? Now, taking these particular contexts, even in these more challenging contexts, have a think. Is it really true that person-centeredness and educational approaches are not effective? Or perhaps it is the ineffectiveness of the approach is due to perhaps inflexibility or non-innovative application of these more person-centered or educational approaches. And it's something that you can actually start thinking about in terms of your own practice, but as a much more general approach to how you approach your own practice and others. So we've now come to the end of this video. In this video, we have looked at the benefits and some potential risks of physical activity. We've also had a quick look at what are the recommendations for physical activity and whether people worldwide have met these physical activity level recommendations. And given the rather dire situation regarding physical activity level in the general population, we've also explored what risks sedentary behavior has on people's health. In order to help us support people in developing lifetime physical activity habits, we've briefly examined what are also the facilitators and barriers to people engaging with physical activity. So I hope this video has provided you with some introduction into this topic.